Content in this video should not be construed as medical advice. It is for information purposes only. Please consult your physician with any health concerns or questions.
I'm Dr. Amanda Nichols with the Women's Clinic. One of my favorite things about my job is meeting girls who are going to the gynecologist for the first time and really helping them with that anxiety-provoking first visit. I often get asked how to choose an OBGYN and which one would be the best for you. We actually have bios on the Women's Clinic website, twc-ms.com, of every physician and a little bit about themselves. So that's one way that you could get to the physicians here and decide who you would like to see. Around the age of 18 is when girls need to start coming to the gynecologist, and another good time to make that transition is after graduation of high school, prior to going to college, because that way we can talk about the important issues of getting the cycle regulated, birth control if needed. We can also talk about Gardasil, the HPV vaccine, and getting that started prior to going to college. Girls who need to come in prior to the age of 18 could experience any number of problems. The most common ones that I see are severe cramps during their menstrual cycle, menstrual irregularities, heavy bleeding, but also acne, pelvic pain, ovarian cysts, but those are the most common. When girls come in for their first visit, I like for them to come into my office rather than the exam room initially. That way we can just talk about any problems that they might have, any questions that I could potentially answer. We go over the medical history and surgical history in a more relaxed setting, and then when we go over the history and answer questions, then we go to an exam room and then proceed with the exam. What girls can expect when they come in for their first exam is number one, a breast exam. We need to start making sure that there are no lumps or bumps or anything abnormal in the breast tissue. And then also just a basic pelvic exam is needed just to make sure that everything appears normal. That doesn't necessarily include a pap smear, although it could depending on your personal physician and what you want to do. Pap smears are typically recommended to start at age 21, and a common question that girls ask is, well, what's the difference between a pelvic exam and a pap smear? A pelvic exam is just where we look at the pelvic organs, the female organs, and just make sure that they all appear normal and feel normal on exam. A pap smear is actually where we take a brush and sample some cells off the cervix to test for cervical cancer or the precursors to cervical cancer. Although the first gynecologic exam can be somewhat anxiety-provoking, it's really a necessary part of being a woman. It's something that we all have to do every single year, and it's a very important part of health maintenance.
Thank you, Dr. Nichols. If you would like to discuss this or any concerns, please contact your physician at the Women's Clinic at 601-354-0869.